Hello, assalamu alaikum, ji alu, pakhair agale, ni hama, tune shumme, washmale, ohio, guzaimus, guten morgen, privet, and hi, hugs and hellos.
Oh God, there's another one now.
To everybody who's tuned into PT1 and PTV Global right now, you're watching World This Morning alongside Shazad and Maha. Hello Maha, how are you? You look stunning, beautiful,
Thank you.
fantabulous.
Well, that's what the thing is. When I'm not feeling too well, I think you kind of do, you overcompensate. So I think I'm just
No,
got
that
more
wasn't
makeup on
really
today.
overcompensation because I don't really lie about that.
No, me. I'm not feeling well, so I have made more effort to look better.
That's great.
But don't take everything so personally.
No, but it's a compliment. You literally do look good.
Thank you.
And stunning as well.
Yes.
How are you? What's happening? Today's Thursday.
Yes, thank God it's Thursday. No, I'm kidding. It is Thursday. It's an important day because we have a very good show for you. But I'm very well. I've been really excited because of the shows that we've been doing lately.
Exactly.
We've been doing shows on personal growth, on societal growth, and even yesterday you guys did a show on cyberbullying, which is fantastic because in the 21st century, everything's moved forward so much that we need to kind of prepare ourselves.
Exactly, and when we talk about preparing ourselves, I think we need to prepare for all of those diseases which are prevalent within, the medicine or probably whatever goes around and comes back as well. Because with the progress of, technology, with the evolution of technology and the human mankind, earlier in the days, people used to actually die of TB. Tuberculosis. People used to die of cancer, but now the life expectancy can be increased just because of the fact that there has been tremendous newer technologies being introduced within the field of medicine. But now, lately what has happened is that, for example, if people, they will get arthritis or probably, if their tissues are not working properly, if they're damaged, or probably if you're losing hair. Now, the only options were to probably get a bone marrow transplant or probably a hair transplant done. But now,
a wig.
But now, you know what? The best part is that there are stem cells therapies which we call regenerative medicine.
Yes, exactly. It falls into that. So stem cells is about replacing dysfunctional or disease or damaged tissues, as far as I'm aware.
Yeah.
But we've done shows on this in the past as well. So we'll be discussing what is now the situation in Pakistan, as we always do. But like Shahzad said, in medicine they've made so many advancements, and we are so advanced in regards to the research and what the different diseases are, but Pakistan is not up to date with the stuff that they're offering.
Exactly, and you're saying it very correctly, because for all those people who actually have to preserve those stem cells, they actually have a facility within Turkey. So if they take out a sample, they send it to Turkey, they do all the culture type of thing and then send it back. Obviously, it involves quite a lot of cost as well, and it's not that easy. But just because we thought that it's not that easy does not really mean that it is or it is not. So we have got experts over here who will actually talk about regenerative medicine, which I think is a translational engineering or the tissue engineering or something of that sort. But we'll
I have no idea. Yeah, so let's introduce our guests and discuss the situation in Pakistan regarding stem cell therapy. So we've been joined by Dr. Salman Gillani. He is a medical doctor specializing in stem cells. Assalamu alaikum, good morning. Thank you so much for joining us.
Thanks for having me.
Besides Dr. Salman Gillani, we've been joined by Dr. Tahira Shahid. She's also working in regenerative medicine. Assalamu alaikum, good morning. Thank you so much for joining us.
And you guys are team members, right? We said it.
Yeah.
Are you guys happy now?
Okay, great. So we'll start with you, Dr. Salman, because it's a very big subject. Just very briefly, tell us what are stem cells and stem cell therapy.
Okay. Stem cells are naturally occurring cells in our body, and their basic function is whenever there is disease or any injury, they are activated and they try and bring the body to the normal. This is basic function, and these are what stem cells are.
Okay.
Lately, specifically in the last decade, there has been a lot of research in these stem cells, and not just stem cells, cells in particular. We call it cell medicine, which is a branch of regenerative medicine.
Okay.
And as you were saying, regeneration is that whenever we have a loss of tissue anywhere, or loss of cells, our body tries to recover from it. And this is through the power of these cells that we utilize and treat various diseases through it.
Okay, before we move on to different types of stem cells, I first of all want to know about regenerative medicine and the origin of it too.
Okay. Regenerative medicine basically means that you're regenerating a part of the body, a tissue or cell, which has lost its function, which is gone in simple words. So it has been around for a very long time. Traditional medicine has been exploring the power of a cell for centuries now. It is where most of the world's medicine was based on,
Right.
the regenerative power of our own body. Most of the treatments in the world, be it Chinese or homeopathy, they actually base their treatments on the power of our own cells, our immunity.
Okay.
And that's where we're actually coming in stem cells as well.
Okay, excellent. So there you go. There's your answer to
Yeah,
regenerative
exactly.
medicine.
But now different types of stem cells as well.
Okay. Basically, there are three types of stem cells. One, which we call embryonic stem cells, which are pluripotent stem cells.
Okay.
These are present in when the baby is growing inside the mother's womb, from day 5 to day 14.
Okay.
In between that time, the cells are called embryonic stem cell or pluripotent stem cells.
Is that the one in the umbilical cord?
No,
that's something else.
those are actually adult stem cells.
Okay.
Which brings me to the second type.
Okay.
Adult stem cells.
All right.
Anything after that time are adult stem cells because they have committed to a lineage, because they can now make a certain amount of stem cells.
Right.
Not all of them. Pluripotent stem cells have the capacity to make any cell type, any known human cell type.
That's the one with the baby.
Right, within the
It's
baby.
just like
Right.
layman's terms, guys.
Right,
Okay, to
there you go.
simplify.
Now, adult stem cells are present in umbilical cord, as you were saying, because usually the fate of umbilical cord is we throw it away, but now through research we know there are very potent stem cells in
Yeah.
there. And then every single organ of our body has its own stem cells residing in a specific location. We call it a niche, a stem cell niche. Be it heart, be it your brain, be it your kidney, everywhere we have those stem cells. So those are adult stem cells.
Right.
And then there is a latest technology which is called IPS, induced pluripotent stem cells.
Okay.
And Professor Yamanaka from Japan, he was given a Nobel Prize in 2012 for his discovery in 2006, where he used the regular cells of the body, programmed them to behave like stem cells, and now through these pluripotent stem cells, embryonic stem cells, and now through these stem cells, you can actually make any tissue of our body.
That's
so this is the
amazing.
latest technology. So to answer your questions, there are three types of stem cells.
Wow, okay,
Right.
that's amazing. Okay, now going forward in regards to the different types of stem cells, what are the different types of treatments available then?
Okay, now through these three different types of stem cells, we can have multiple clinical applications.
Right.
So for the patients, so how can we treat the patients? We only, in Pakistan right now, we're only utilizing the technology of adult stem cells because it is stable at the moment.
Right.
But a lot of research is going into iPS cells, and hopefully within the next few years, it'll be available for clinical applications as well. To date, there are almost 100 diseases, individual diseases, which we can treat through stem cells.
Right.
But would you mind telling
Okay.
us about all of those diseases so that we can dig into all of those diseases? That
It
how
might
would
be
this
hard to tell
therapy-
you about all of them, but
Well,
I'll
we
try.
don't really have time.
Probably the major ones.
Sure. I'll give you a broad range. So
Yes.
neurological diseases, which has to do with your brain
Yeah.
and spinal cord, and then your musculoskeletal, your muscles and joints, and then your cardiovascular diseases, blood-borne diseases, in which your blood diseases and cancers come in. That then other types of cancers. Then aesthetics has a huge application through stem cells, and so these are the broader examples. So if I try and give you specific examples, we can treat arthritis.
Okay, you said it
through-
will weird. Let's talk about
Okay.
that because I do have a list of different
Okay.
diseases I want to touch
Yeah.
on. But I'd like to bring Dr. Tahira into the conversation. You've been working in regenerative medicine, so tell us what kind of work have you been doing?
I've been working with Sir lately, and we have been treating a lot of diseases, right?
Okay.
So right now we have the most common ones that we are treating are joint ones, joint disorders like arthritis. People come to us with joint pains. The reasons can be different. It can be either rheumatoid arthritis or osteoarthritis, or they could have some kind of injury because of which they have this. And then we're doing the most basic kind of stem cells for them. And when we are treating them with those, they have like phenomenal results, and they actually show improvement even without having to go for a knee transplant.
Okay.
Because most of them going to doctors are advised by orthopedic surgeons here that they should go for a knee replacement, right?
All right. Yeah.
So a this is something that can save the knee replacement. So they don't have to go for steroid injections. They don't have to go for lifelong painkillers, which will eventually damage their kidneys and damage them. And they do not have to go for something as drastic and as big as a knee
That's amazing.
replacement.
Sorry, I just want to pick up on this osteoarthritis situation because majority, a lot of people within this country suffer from arthritis because of lack of vitamin D and all that
Yes.
kind of stuff. So now, it can cure arthritis?
Okay. Yes.
100%.
Okay. I'll
Yeah,
come
so
to
yeah,
that.
so that's the question.
Okay.
It can
Cure
cure
is a
arthritis?
very-
Question mark.
Okay. Cure is a very strong word.
Okay.
You know, we can treat arthritis through this.
Okay.
Even with your knee replacement, it is not actually a cure. You're just treating a condition.
Yes.
And it can actually come back. Cure would mean that you inject some cells and it'll be cured forever. It can happen.
Okay.
But the patient has to be on a strict regime of physical therapy. So for that regeneration to keep on going.
All right.
But osteoarthritis, which is, as you were saying, it is the most common disease of the elderly throughout the world, not just Pakistan.
Yeah.
This is the most common disease of the elderly. Osteoarthritis is
And
specifically
even
of the
some
knee.
young people are now starting to get
Now
it.
they have started to have that because of what you were saying, because of vitamin D deficiency.
Yeah.
Because we don't get proper vitamin D.
And then when you go for jogging on like hard tracks and
But you don't go in
trekking
the
and all-
sun.
and
People
all of
wait
that
till the
as
sun
well.
sets.
Yeah.
There you go. Yes.
Yes.
So our sun exposure has been limited because of many factors.
Because we just love to dress up like fully.
Yeah.
Right.
I think that's what it is.
Yeah, no, so we don't want to get a tan either. So we want to stay out of the sun.
That's one
Okay,
reason.
so in regards to so what's happening with this? It's,
Okay, so with a lot of patients that come to us, they have been advised knee replacement by some doctor, and most of them don't want to go for surgery, and cost is always a bigger issue in Pakistan. So through this technology, through stem cells, we take their own stem cells from their bone marrow, process it, and then inject it into their knees.
And then what happens?
And then the basic problem in osteoarthritis is that we're losing our cartilage,
Yeah.
which is the covering of our bones, which is protecting the joints from rubbing against the bone, in simple words.
Okay.
So when we inject those stem cells, they start regenerating that cartilage.
Okay.
And as soon as you have a rim of cartilage all around your bone, your pain is gone.
Okay, and in regards to, so you had, that's osteoarthritis, correct?
We have
Now-
rheumatoid arthritis.
Okay, exactly. And so what about, so in regards to, so this is for arthritis, so osteoporosis as well, it's used to treat these things, and
Yep.
like even if it's in the back or in the hips?
Yes.
Wow,
Yes.
that's
No, but
amazing.
it can just naturally develop. I mean, do we have to really guide the cell too as well? I mean, look after it or do something with it?
No. The patient doesn't have to guide the cells. We guide the cells.
Yeah, obviously. How do you do it? I mean, that's
Inject it in
what
that
I'm
site.
asking. That okay, if the cartilage is missing now, or probably a
That is
bit
a-
of it is left behind, how would it just come back
That is
like
a
that?
very good question.
Thank you very much for
Because, as we were saying, through stem cells, we can achieve any cell, right? So we get those cells which are going to make the cartilage. Those are your mesenchymal stem cells that are the precursors of your cartilage. I hope you
Yeah.
understand that. They are going to make the cartilage.
Because
okay.
they are
So we're
the
only-
cells of that cartilage
There
as
you
well.
go. So
That's
these are
why
the
they
cells
need to
that are
stick together.
required because when we are young, we have the synovial fluid in our joints, which has those stem cells,
Yeah.
which
Okay.
keep repairing our cells whenever there is injury. Like you must have seen the kids. They always bump and bruise, and they have their knees always injured. But they get up and then they start running, and they don't have any long-term effects of that injury. But if you have that injury in your 30s or your 40s, that stays with you throughout your life.
Yeah.
That's because your stem cells have
stopped.
stopped working in your knees.
Okay.
Okay, but
Very
now what I
fascinating.
want to know is what is the difference between, I think I'll pose this question to Dr. Tahira over here. What is the difference between rejuvenation, replacement, and then regeneration? Are these the same terms within the stem cell therapies, or there are differences to it?
Well, there are differences to it. Now, regeneration, you're going to regenerate whatever was lost, right?
Alright.
Rejuvenate is it's already there, and you're increasing its ability to, you're freshening it
Potency.
up, you're refreshing it,
Yeah.
right? Basically, so the term rejuvenate is used more for the skin. Right, it's used more in aesthetics because something is not really lost. Your skin. When a patient comes to you, he's more of a client, right? He doesn't have any damage as such, but he wants to maintain his skin, his or her skin, wants to maintain that youth, wants to maintain that ability to repair itself. So somebody comes in for rejuvenation. Stem cells offer more of a more genuine aesthetics than anybody else.
Okay, and we're going to move on to this because this is a very important subject and we're all very fascinated by it. But now moving on, I'd just like to focus on the big diseases and illnesses. In regards to cancer, how can stem cell therapy be used?
Okay, you might have heard about bone marrow transplant.
Yes.
Bone marrow transplant is actually a stem cell transplant, which is with a specific type of stem cells. Those are hematopoietic stem cells. Okay, and they have been used in 1968. The first bone marrow transplant was performed.
Right.
Ever since then, there has been research on stem cells.
Okay.
Now, the latest technology is your own immune system. It is called immunotherapy. We use those are called NK cells, natural killer cells, which are the defense mechanism of our body. We charge them with their immune system, and then we put it back into the patient. And that's how they fight the cancer. So this is the latest in development in cancer.
Yeah, I'm again going to use this very hard term, cure. Is it like 100% cure, or it's going to increase your life expectancy?
In certain cancers, yes. To give you an idea, let's say for
CML, AML.
So for your leukemias and lymphomas, yes, we go to a cure. But let's say for a pancreatic cancer, it is an adjunct therapy to your chemotherapy and other radiotherapy.
So how,
do you get your point? Do you get my point?
I'm trying to get your point.
In certain cancers,
you
it
can
is a
completely
cure.
cure it.
But in certain cancers, it is just an adjunct therapy.
Okay.
No, but since we were earlier talking about stem cells, and you said that you guys are going to take it out of our body and then put them back. But this is not how it happens in a blood transplant, right? Because you have to get a match and then put their cells into your body.
So how does it work?
Okay, so what you're saying is we can actually use somebody else's stem cells if the patient's own stem cells are not working properly.
Right, okay.
Okay?
Yeah.
That'll be the only reason why we use somebody else's stem cells. So those are mostly in cases of diseases which are blood-borne diseases, in which your stem cells are diseased, ever since you're born.
Okay, so sorry, this question just occurred to me. So in regards to HIV and AIDS then, can you cure that with stem cells?
Theoretically, yes, but the clinical application is not stable yet. We're not to the point where we can start using it in the humans.
Okay,
See, with any medicine, and specifically with these stem cells, we have to be very careful. When we're coming into the clinical practice. So we have at least 2 decades of research into stem cells before we actually started doing it in humans.
Okay, we will definitely talk about the risk involved in the stem cell therapies, but to which point are we, or probably what have we achieved in terms of HIV and AIDS?
Okay, as I said, there is a deficiency of certain cells in our body in HIV.
All right.
So right now what we're doing is we're actually replenishing those cells. So for any patient, we actually give them those cells. So the research is going on where once we trigger that response, the body will start producing its own CD4 and CD8 cells.
Okay.
Do you get my point? So we're not there yet, but we'll be there.
We're on the road. Okay, okay.
Yeah, moving on. I just wanted to ask, because one of the other very common diseases over here, or probably, what happens is that, too many people are exercising, too many people are going to the gym, and then they get like disc prolapses as well, and then a slip disc. And then people over here within Pakistan do not want to get it operated just because of the fact that they thought that it might do something wrong to them and their limbs might not work. I mean, that's what the news is all around.
Right.
So can you be of any help in those terms as well? Because
absolutely, we have treated many patients with backache, and it is very commonly known as sciatica.
Yeah.
You might have heard of it, because there is a disc prolapse, and you have a pinched nerve.
L4, 5, or probably C. Or,
There you go.
Yeah.
So you
don't talk
use
about
for
yourself.
that?
There are other patients who you might have an L3 or L4. Sorry.
So you can use it to treat this?
Absolutely, we are actually treating patients who are getting better, and I don't know if you're on, do like our Facebook page, because what we do is we actually keep putting the patient stories on our Facebook page. So there are stories where patients who were not able to move are actually right now moving, doing their own.
In regards to this, for example, the question
Disc prolapse.
the disc prolapse discs and all these things. How is the treatment actually done? Like, how would you go? There's no operation.
No.
Like, how does it work?
Because what happens is that whatever
You
is
inject it into the bone.
because whatever is
Into the
around
disc.
your disc,
It's a disc.
it's gone, right? Whatever is around that jelly thing,
There
it's
you
gone.
go. Nucleus
and then it's
pulposus.
protruding, yeah.
Awesome.
Okay.
And then how do you get it back in shape then?
You have a lot of knowledge about this.
Yeah, I went through it.
I thought so.
Yeah.
Okay. So, yes, you're absolutely right. So that jelly-like material is called nucleus pulposus.
All right.
And it prolapses, and the disc bulges out from the sides,
Exactly.
which impinges on the nerve, and that's why you feel the pain. through stem cells, what we do is we inject those stem cells into the disc, and the nucleus pulposus regenerates. It comes back to its normal position.
Incredible.
So all of that bulge is gone then. So that is, again, that's a natural cause, natural treatment.
Okay,
of that
wonderful.
disease.
Very nice. But one last thing before we go towards the break, and that is that, when we go beyond, like, I mean, on the upper side of L3, that's where the risk is involved majorly. I don't know what they say, that there's something very special over there within your...
That's called a spinal cord, you know.
Yeah, I know. It's
So basically, everything that you go and do anything.
yeah,
from
I know it's called a spinal cord, but they had a very different word for it. When I was going for my operation, they called it haram maghaz, or I don't know what
That's what it is.
Yeah.
Okay. Oh,
Spinal
so,
cord.
okay,
Yeah, haram
so can you do something to that if the damage is...
Spinal cord injury, yes.
Yeah.
Again, we're treating patients at our
Okay,
clinic.
no, I know about this actually. So let's go for a short break, and when you come back, we're going to continue the conversation. It's really fascinating on stem cells. Stay tuned.
Good morning. All right, people, welcome back. And for everybody who just got tuned into PT World and PTV Global, you guys are obviously watching World this morning. I'm Sir Shahzad and Ma. And today we're talking about regenerative medicine and the role of stem cells within the field of medicine, obviously.
Exactly. So now, moving forward, so in Pakistan, because we talk about different treatments, different diseases it can be used for, within Pakistan, where are we?
Okay,
Clinics,
I moved back to Pakistan about 2 years ago, and then I started practicing stem cells, but we didn't have the facility of highly specialized stem cells because Pakistan does not have a GMP certified lab, and I have to specify
What
this.
do we mean by GMP certified?
GMP is good manufacturing practice, where all of your international standards, where anything that goes inside the human body can be processed.
Okay.
And you make your vaccines and your injectables in that facility.
Okay.
But we have the facilities that make vaccines and injectables, but we don't have any such facility, a GMP certified. Again, because a lot of people from Pakistan started calling, oh, we have a lab in Lahore that does this. But I asked them if you're GMP certified, and they were not. You know,
Okay.
so we're trying to make a lab which is GMP certified, and if anybody wants to come and join our hands, they're more than welcome to come and start doing that.
I thought about joining hands.
Sure.
It's all right.
For a stem cell lab. That is.
Okay.
Probably I can be the investor,
Right now we're utilizing the services
Okay.
of a certified EU certified company in Turkey.
And they were on our show last time.
And they were on your
Yeah.
show, yes. And that yours was the only show that they were on while they were here. So
Excellent.
there you go.
Okay.
So we utilize their services for the highly specialized stem cells, and through that, we're treating diseases like diabetes, spinal cord injury, stroke, or traumatic brain injury, and your MI, or heart attack, as it is called. So diseases like autoimmune diseases, we're treating through those stem cells.
Excellent. That's amazing. Now, so that's all happening within Pakistan.
It is happening in
Oh,
Pakistan
that's
today.
fantastic.
And
Now,
it's the only place in Pakistan. Let's,
Sorry?
let's make it clear to the viewers that anybody else who claims to do it, that's not
it's
true.
not legitimate.
Yeah.
Okay.
Right.
So,
I mean, and if you are claiming that you can do it, probably what you need to do is you need to come onto the show and let us know as well.
Yeah.
There you
That
go.
Well, no,
you
because
guys are
what
literally
you're
well,
doing
we'll
it.
have to make sure that you guys
Yeah.
are all certified because we don't want to get into trouble ourselves. But the thing is, yeah.
Yeah, all I wanted to ask was that since you mentioned about cardiovascular diseases and then strokes as well. Now, probably people might be interested in that. If, for example, if they get to know about how do you treat a stroke, because over here, for example, if somebody gets a stroke, what happens is that they do not want to operate it, and then all of the damages to your limbs, they say,
already
is
done.
permanent. So the type of treatment which is available with you guys in terms of stem cell therapy, I mean, is it like the body movements are restricted, or you will get better, or you'll be normal again? And how would you do it?
We've recently treated a young guy who had a traumatic brain injury. He had an accident, and all of his movement on the left part of his body was gone. So as you were saying, it was a common belief that once your neurons are gone, they're gone forever.
Yeah.
When I was a medical student, I was told that neurons do not regenerate. But then, while I was doing my training in stem cells, we saw patients with stroke.
Yeah.
They were getting better. Even without stem cells, they were getting better.
Okay.
That means that
And that is your innate stem cells that are regenerating. So it is not true that neurons do not regenerate. They do
Okay.
regenerate, but they regenerate at a very slow pace.
Okay.
Through stem cells, we enhance that process of the body's natural ability to regenerate. So we are injecting those stem cells into the backbone,
All right.
at the bottom of your spinal cord, at L3, L4. And those cells then start the regeneration wherever it is required, wherever there was degeneration.
Automatically. Okay, that's great. Now let's just move on towards the risks involved within stem cell therapies, and make sure that you let us know the truth.
Yeah.
Because of the fact that quite a lot of times what has happened is that doctors have been here and they never said what was required of them.
Okay, but before we talk about the dangers and all that, I'd like to talk about the aesthetics.
Yeah, sure,
So
sure.
that we can bring the dangers of that within.
There
Yeah.
are no such dangers.
Oh,
First,
wonderful. Okay, so in regards to aesthetics, how is it used? Like, what can you use it for?
we can use it for a number of things, for regeneration and rejuvenation of the skin and the hair. Basically, it's anti-aging.
Okay.
Right? So you're aging with time. As time goes by, your ability to regenerate or repair your skin starts
But
decreasing.
yeah, the
right?
muscles get less
So there-
elastic
Yeah.
and-
So what we're doing here is something that nobody else is, and it's patent. What we do is we do a biopsy from behind your ear. That's the procedure. But what we're basically doing is we're generating those cells in your skin that are able to repair themselves and to rebuild the collagen and the elastin on whatever your skin is losing. Right.
So you can never look old.
Yes,
like potentially
actually you can't. That is true. And like the other things, aesthetics nowadays are basically artificial things, right? Where people are actually injecting Botox or fillers into their skin to look younger. But this way, it's your own mechanism, your own cells that are repairing themselves and regenerating all that is lost with age, so that you look better even without those artificial things that are temporary.
Okay, so it's because when someone's used Botox, or when someone's had fillers, or they've got a
but
facelift.
that way you won't.
This way you don't?
You don't, because you'll look your own self
And you'll
10
still have
years
like
young.
wrinkle, like, as in you'll have expressions and
You'll
stuff.
Yeah.
still have expression
You still
because
have
they're all in the natural range, right? Because it's your
Wow.
own cells being told to repair themselves.
Nope.
Your own cells are taken out, they're sent there, those fibroblasts are made, and they're re-injected back into
Yeah,
your
that's where I'm
Amazing.
getting confused now. Okay, for example, you take the stem cells out from whatever the SOP is from behind the ears,
Right.
and then I don't know what you do to it.
Yeah.
But for example, if I'm 29 right now, obviously my stem cells would react like as if I'm 29, right? So how would they actually make me look like as if I'm 25 because those stem cells were taken out of me when I was 29, right?
No, what
So-
is a stem cell? Stem cell
Yeah.
is not the cell that has reached that age, right?
All right.
Stem cell is that cell into your body, no matter how old you are, it stays in the baby form. It's the cell that goes to different parts to repair itself, right? So the
Okay.
stem cell isn't the one that's aging.
So I
that
can
is
still
why it's
have a
called
baby
stem cell.
skin. I mean, back in
Yeah.
the days when I was in
You
my
could.
university, girls used to touch my cheeks. Oh, you're
Oh,
so
Shazad,
cute.
please.
So I can get those cheeks
Do
back.
they?
Already.
Do they? Yeah, well,
Really, you want to do that?
But there are people in the MCR, they're saying you still have those
Which is
cheeks.
quite
But, okay,
disturbing.
I'm not letting you touch it.
Yeah,
alright?
exactly. So anyway, no, okay, because and moving on.
Right. And
So that's
the same for hair as well.
Okay,
So,
now in
yeah.
regards to the hair, because there are certain illnesses that people get. So, for example, with alopecia, can you do something
Yes.
with that?
Yes,
Okay.
exactly.
Does it depend on the type of alopecia someone has?
Well, it does depend on all of that, but what is it? What is alopecia? It's the loss of hair, right?
Yeah.
Due to
You
whatever
just-
reason
yeah.
it may be. But if there is a loss of hair because the follicles there are not able to produce it, right? So when you are injecting stem cells, and along with everything else, like a lot of PRP, people are doing a lot of PRP, but when you do it with stem cells, what you're basically doing is you're actually creating that thing that is lost, right? You're actually
Wonderful.
replacing what is lost. So it's not just something, you know?
But how do we do it? Do we like inject our stem cells somewhere here
Yeah,
or wherever
in
the
the scalp.
alopecia is taking place
Yes,
or
in
hair
the
fall is?
scalp.
Whatever, in
And
the
then how long does it take?
For the process?
Yeah, for the hair to grow back.
Oh, is
Everything
it?
takes 3 months, basically.
3 months at least?
At least, yeah.
And then even if you do not have roots, I mean, you're just completely bald, they'll still grow?
No,
There
no,
are
no,
chances?
No, no, no. Yes,
Or
you,
what?
No,
you
no.
have to be very careful about
Yeah.
that. You need to have some innate cells for them to regenerate.
Yeah.
So if you're completely bald, so there are no cells to begin with.
And how would the cell probably
Right. So
behave?
what-
that
what-
So
So
you're supposed to
alright,
catch
what
it
am I
before the
supposed to do here?
cell completely dies.
because it's gone completely.
Right, yeah.
So
Because
you-
what will
if-
happen is our look is made through our hairline.
Yeah.
Once we lose our hairline, that's when the baldness starts to show more. So the clients who come to us who have an intact hairline, we give them the opportunity to go ahead and do this treatment.
Yeah.
But if your hairline is gone, so then we combine it with hair transplant, stem cells with hair transplant. So you get your natural hairline, and then
It's available. Excellent. Okay, so now moving forward, so let's talk about the dangers of stem cells. So
Okay.
tell us about that.
All right. So first of all, remember you were talking about like you can use somebody else's stem cells.
Yeah.
So there is a very stringent matching involved with that. So if you're not completely matched, obviously those cells are going to cause damage inside your body. We call it rejection.
Okay.
Rejection is your body is not accepting those stem cells.
Okay.
And there is another disease which is more dangerous. It's called GVHD, graft versus host disease. in
Okay,
which-
wait. Before we move on to the second one,
Okay.
if your body rejects the stem cells, what are the consequences
dead.
of that?
No, you're not.
blood-borne diseases, you are, I
The
think.
cells are dead, which means that the procedure that you did was a failure. It didn't do anything.
And how will
No,
the
but
body?
then the
disease-
immune
the dis-
system is going to get weaker, and
How
then,
does
for
the body
example, if you
react?
get
Right.
an infection, you're gone.
Oh, well, yeah, there are obviously
to be
treatments
honest.
for your infection.
Okay.
But yes, because the thing is, so the primary disease is there,
Okay.
and the cells that you injected did not work. That's
Okay.
rejection.
Okay,
Yeah.
but how does the body react to it then? Like if it rejects it, does
See,
you
it's
get
a very
sick?
complex procedure. We have to put them on immunosuppressants, so their immune system does not attack those newer cells, specifically in the first year.
Okay.
Once they home into our bone marrow, then we don't have any concern of cross-reactivity because the process is called chimerism.
Okay.
You know what chimera is?
No,
The
I
two-headed monster?
Yeah.
So that's
yeah,
what
the
it is.
chimera, yeah.
So chimerism is that the bone marrow now has the HLA of both the recipient and your own. So it's not going to attack these cells, but that process takes 1 year.
Yeah.
So I know it's a lot of detail, but
Okay.
that's how it
But
happens.
that is true for any transplant.
Okay.
It's not just stem cells.
Yeah, no, not just stem cells. That's true.
All right, but do you get another chance, for example, if
Yeah.
the rejection's there?
Absolutely.
Do you get another chance?
You
or
can,
Probably if you
absolutely.
have another match.
Yep.
All right,
You
that's
can.
great too, I think. And moving on, for example, when we were talking about the backbone and the
Right.
spinal cord diseases as
So
well,
in
what are the
those,
dangers involved
so
in
when
that?
we're using your own cells, the beauty of those cells is they're not going to get and give you any reaction
Yeah.
or any side effect. So that is the beauty of those stem cells. We call it autologous stem cells. You're using your own stem cells.
Yeah.
So the whole, the side effect that can come from your own stem cells is the processing of those stem cells. So remember, we don't do any processing here in Pakistan. We get all of these processed in Turkey. And very soon, inshallah, we're going to start our own GMP facility
Right.
here so that we don't have to export and import those stem
So
cells.
best of luck for that too as well. But when you send stem cells to Turkey and when they come back, what is the process involved in it? And how would you know while injecting over here whether the processing was right or not?
That is a very good question. Again,
Thank you.
what we do is we take the bone marrow out and then we send it to Turkey. And as soon as it gets there, again, so there are very stringent ways in which we transport it. There is special media through which we transport it. And as soon as it gets there, it goes through the quality control process.
Whether the sample's right
So
or
if
not.
the sample is right or not, and throughout the transportation process, if anything happened to it.
Okay, excellent.
So again, we check everything from going there to coming back, and then a report comes back, which tells us that this is how it was processed, and that report can be checked through a third party at any time.
Okay, so now, because we are running short of time, so I want to talk about the whole, the thoughts and the feelings about stem cell research. From what we've talked about, it's a miracle.
It is.
It really is. Anything can be, treated or cured, all that stuff. But why is there still so much apprehension, lack of use, lack of awareness on the stem cell therapies?
See, it's a newer technology, and it is in a way changing the way we are practicing medicine. So, the traditional medicine is always going after your symptoms, but this is where we're actually treating the disease itself,
Yeah.
where it is causing the problem. So obviously, whenever there is a change, there is a lot of problem with the acceptance, not just from the patient's perspective, but from the healthcare perspective,
the
as well,
industry itself.
and the industry as well. So since it is new, I still remember my professor telling me that when the laparoscopic surgery, which is a gold standard of surgery now, came here, everybody was questioning it. Oh no, this is not how it can happen. How are you going to see what's going inside and this and that? But now it is an established fact, and that's the same with stem cells.
Okay,
Exactly,
excellent.
that's what it is. But now
in the very near future, this is how medicine will be practiced.
No, but would you guys be making more people aware of the fact that this technology is here in Pakistan, because we can try our best.
That's our goal. That's why we are here. And thanks for inviting us to
No problem.
tell the world. This is what we're doing in Pakistan.
But is it a patent technology or?
You want to invest in it? Sure.
No, it's
No,
not
he's
about
not
investing
gonna-
in it. All I'm saying is that if the technology is here, I think it should be available for every other common human being in
It is.
Pakistan as well.
It is.
It is.
It is available for
Okay,
anyone.
and in regards to the cost as well, what are we looking at? Is it more
Okay,
expensive,
give you an
less
idea.
expensive?
No,
It
I
is
think it
way less than
way less expensive than
anywhere else.
traditional
What are we
medicine.
doing? Why are we still discussing it? Why is it not so normal?
Right, because this is when people come to us, they the reason why. Remember, I told you about our Facebook page. That
Yes,
the
exactly.
only reason of us putting the patients' stories on Facebook is so that they can know that these are common people with these common diseases who are getting treated every day, and these are their experiences. So remember we were talking about how we send those bone marrow samples abroad, and people have a lot of questions about. So how do you take that bone marrow out? It's a very simple procedure,
But it's
but a
painful.
lot of people don't know that.
Yeah.
So they're afraid that it might be a
Absolutely.
surgery. It might it might have its own side effects. So
Okay, so I have another question. I just thought about this. So if someone has cancer and it's progressed, and there's been a lot of damage from the chemotherapy and all that stuff, and from the cancer itself. While you're having cancer, the therapy for the cancer, can you have stem cells to make
Absolutely.
sure that you stay strong? Because
Absolutely.
to prevent it from going further.
Yes, we call it immunotherapy, and yes. So what we're basically doing is we are telling our immune system to fight those cancer
amazing.
cells.
Yeah.
To give you an idea, this is a very interesting subject. Every human being makes many cancer cells every day. You and I, everyone.
Yeah.
But our immune system takes care of that.
Okay.
You see, most of the cancers appear later in our lives because that's where our immune system is giving in.
Okay.
And that's what, through this immune therapy, we can strengthen their immune system and fight that cancer.
Amazing.
But that's great. But one
And
last thing which
okay.
I wanted to ask, and that was obviously, there are problems and issues related to the awareness of the stem cell therapies or the regenerative medicine. And I think that the only cause of it is that over here within Pakistan, people are so prone to the idea that, let's get a second opinion. But, if the treatment is only available at one place, where would you go to get like a second opinion
Again,
as well?
man, that is such a good point. In the sense, people come to me and then they go for a second opinion to another doctor who has no idea about stem cells, and they say, "Oh no, don't get stem cells." And these poor guys, stem cells probably are their only hope, and they're
So basically,
told-
it's not probably not as much of a money maker for the medical industry or the pharmaceutical industry, I guess, stem cells.
Oh, that is
Yes,
too.
that is
that is a concern.
that
too.
is the
Okay, so that's for the next time. So we've got some.
So it's like, no.
Next time we're going to talk about umbilical
Yeah.
and adult stem cells, and we're going to talk about this whole medicine
So
practice.
it's the same like, FDA not approving vitamin B17.
Yeah, exactly. So with that, thank you so much for your time.
Thank you
It
for
was
having
absolutely
us.
wonderful having you on the show today.
Thank you very
So
much.
guys, I hope you took something from the show. I found it really fascinating. Every time we have this conversation on stem cells, it just leaves me baffled as to
Excites
why
me.
are we not practicing and more aware about it.
Exactly, but don't forget to write to us on our Facebook fan page in case you want their Facebook
Yes.
pages or whatever. They'll
We'll
be
give
shared
it.
on and updated on our Facebook page, which is with the name of
Well, this morning.
on Twitter,
Well, this morning without a G.
on Daily Motion and YouTube,
Well, this morning.
and the fabulous repeat is going to be at
11:05 p.m. this evening. Have a wonderful day. We'll see you bright and early tomorrow.
1, 2, 3.
Good morning.